And welcome back. Time for Health Matters now. And women's bodies, these are, of course, incredible. They're capable of growing life, nurturing, and, of course, sustaining it. But with great power comes, of course, great responsibility, and that to prioritize our health and our unique needs as women. Now, from menstruation to menopause and everything in between, women's gynecological health is a vital part of our overall well-being. And this morning on Health Matters, we're joined by gynecologist Dr. Tinabo Ndebele to help us unpack this. Dr. Ndebele, thanks for coming through and welcome to Morning Live.
Thank you, pleasure.
So this morning we focus on the incredible women's body here and our gynecological needs. But if we start first and foremost, what would you say for a woman is the most important thing that we should know if you look at our gynecological needs as women?
Okay, good morning to your viewers. My name is Dr. Tinabo Ndebele. I'm a gynecologist at Netcare Saningel Hospital. Just like as you said, the most important thing in a woman's body is the health itself, the health of a woman's body. I think we need to be careful to take care of our bodies, because if you take care of a woman's body, that's where the nation is built. A woman gives birth to the entire nation. So I think as the year begins, it is important that we stress on how to take care of our gynecological needs, from teenage life up to menopause. So as teenagers, we see that they are neglected. I think most of the focus is mostly on the midlife crisis from women from the age of 20 to around 45. And then also we neglect our women who are menopausal. So I think it is important to stress that for the teenagers who just started menstruation, they need to be taught how to take care of their bodies, and the symptoms and signs that are alarming, that because so many times we find that they start menstruating because of our cultural and background. Most of the times we neglect and shun the menstrual topics at homes, but it's important to talk to the young girls about menstruation, about what is it that is abnormal. It is the same way a 25-year-old can go to a gynecologist, a 35-year-old can go to a gynecologist for gynecological checkup. Our teenagers should be taken for contraceptive advice. Remember, contraception is very good. There are lots of myths and misconceptions about contraceptions at a young age, but they're actually quite good. There are lots of non-contraceptive benefits of these pills and other contraceptive devices, like in terms of blood loss, in terms of iron deficiency, and just a peace of mind and health, and health-wise.
So I would imagine with teenagers, those visits would be at primary healthcare facilities, or would you advise them to go to a gynecologist? And also, what would be a good time for a woman's first visit to a gynecologist?
I think affordability comes to the fore, but it is as early as they start menstruating. Just maybe one visit in 5 years is okay, just to check are the periods normal, because sometimes you find that you see a patient, they've been bleeding a lot throughout their menstrual life, and you see them after 10 years. At that time they're anemic, at that time they need blood transfusion, So if they come early on and they actually talk to a healthcare provider, and then they are told, because in health, we deal with evidence-based, and we have definitions for everything. So if a certain menstrual cycle does not meet a certain a definition, so it therefore needs to be looked at to see where it can be corrected. For example, also if you give them contraception early with its benefits, you also take the opportunity to talk about the sexually transmitted diseases, which are very, very rampant in teenage lives. You know, so I think those are the most important things for young women. And also, even if they are not yet sexually active, if you talk to them early about these sexual lives and how to avoid infections, how to avoid unwanted pregnancies, and how to prolong their reproductive lives in a healthy way, I think it's very, very important. But I think our focus most of the time is when we hear about gynecological topics, I think we always avoid talking to the young ones, and we always think it's for the middle-aged women. Yeah.
And pap smears, for example, you know, again, as you say, sometimes we tend to get to this later on in life as women. How early should women start getting pap smears?
So it also comes to affordability. So, you know, when we treat patients, we use what are called the ethical pillars, which are 4. So there is what is called distributive justice, which comes to affordability. For most people who are not on medical aid, and, you know, we follow SASOG, which is South African Association of Obstetricians and Gynecologists, usually they say we should start at 25. But when affordability is not there, we sometimes say by 30 at least. That's the time that almost everyone should have had a pap smear. And but affordability there, you know, when you look at in America and other the Europe, and sometimes they say you start as early as 21. But also we must stress that you should not rush too early to start pap smear, because if you start early, you're going to find some bugs that your body was going to take care of. So I think it is safe. In our environment, we say we start at 25, and then you can do it yearly. So you can do it yearly after 25, and then up to the age of 65, depending on how your pap smears were. Then we take you out of the role for pap smears.
Dr. Tinabo Ndebele, and so much more to talk about, but I think it will afford us an opportunity to basically just narrow down certain topics, like menopause. You and I were talking off air, and, you know, just zoom in on that on its own. But thank you so much for stopping by this morning. Gynecologist Dr. Tinabo Ndebele speaking to us about female health and the importance of regular gynecological visits. And as he says, sometimes it becomes a matter of economics, Leanne, but so important, if you can, to do what you must as early as possible.